Welcome to today's webinar about COVID management. The reviews are now underway, and that's one of the reasons for the webinar today is to get a handle on what are some of the lessons that might be learned from what transpired during the pandemic. I've invited David Redman, whose background is emergency management, Gary Davidson, who chaired the Alberta Task Force on COVID-19, and Ari Jaffe over at the University of Alberta, who, interestingly enough, when I had a chat with Ari, shared with me his perspective, some of his own personal transitions in terms of evidence and information as it was evolving, and how he personally went through a transition to arrive at where he is today. I think it's important for all of us to understand that it was a moving target right from the beginning. And we're trying to get to these lessons learned where the movement stops and we can draw some conclusions. So I'm not going to go any further into background of each of the panelists, but I will start out with Ari and ask Ari if you give us just a little bit of background, then Gary, and then David, and I'll ask David if he'll then set the tone of the discussion by talking about the emergency management plans that existed in Canada at the time that maybe were or were not adhered to. So Ari, you want to give us a little of your background and your interest in this topic?
Sure, thank you. Thank you for having me. I am a pediatrician, pediatric intensive care and infectious diseases specialist at the University of Alberta. So I initially was caught up in the groupthink for the first few months. And it took a while of reading evidence until I realized that the best evidence available was quite different than what was being done by the government leaders and the chief medical officer of health and even the administrators at Alberta Health Services. So, and across the world. So I wrote several papers about that. And I think the one that got me invited today was the most recent one I wrote with some colleagues with the Frontier Center for Public Policy that talks about the title of our paper is When COVID-19 Claims of Revisionism and Misinformation Are Themselves Misinformed, and the implications for policy decision-making from that. So I also was an advisor on the Public Health Emergencies Governance Review Panel that was chaired by Preston Manning in Alberta. That report came out in November 2023.
Thank you. Gary?
You bet. So yeah, it's an honor, first of all, to be anywhere near a panel with Dr. Jaffe and Lieutenant Colonel David Redman. They're giants in what they do, and I'm very humbled to be anywhere near them. So, but yeah, I was asked well, in 2022 November, the Premier wrote a mandate letter to the Minister of Health at the time, asking them to strike a task force to review the data used in the decisions made in Alberta during COVID. So it was a data review. Preston Manning, that Dr. Joff was part of, was basically, we looked at it as a legislative review. I wasn't involved in that. And so, but ours was just health data review. And so we want to know where the data came from, what it was, who resourced it, who picked that data, why not other data, who analyzed it, who applied it, did it go the way they thought, was it applied correctly? And then did it turn out the way they thought it did? And if they didn't, what would we do better next time? That's a kind of real rough rundown of the mandate that the Premier asked us to do. And so that was November. We spent about 6 months. If you remember, there was the Premier won the by-election in late October of 2022, and then there was a general election in May of 2023. And so in between that 6-month period, we were forming the task force, writing in terms of reference, getting it all ready to go. Once the election was done, then we got going. So we had about 1.5 years, almost 2 years to do what we did. And yeah, that's what we did. So.
that task force report has in fact been somewhat controversial, which was not a surprise given all of the information, misinformation, uncertainties that have occurred associated with this. David, I was not aware that there was such a thing as an emergency management plan. So could you familiarize us with the framework of what actually existed before this all started that might have provided us with a guideline?
So let me start with a 30-second background. I spent 27 years in the Army as an officer serving all over the world, involved in operations. And the one thing that you learn in the Army is process. And the emergency management process that we follow in 13 out of 13 provinces and territories in Canada is basically the operational planning process that I was taught as a lieutenant and used all through my career. The largest task I did was to bring all the Canadians home from Europe at the end of the Cold War, 18,000 Canadians out of Lahr, all our kit and equipment, using that process, as well as closing in the middle of the Bosnian War, all the Canadian elements there, extracting them from a dangerous situation in 95, and then returning with the United Nations force. After that, I became ultimately the head of Emergency Management Alberta, but first of all, after September the 11th, the Premier appointed me as the lead for the counterterrorism plan in Alberta, which we built over 2 years using that process, linking all of private sector industry together into a response in the time of a terrorist attack in our province. I helped at the request of the Deputy Minister of Health to write the pandemic response plan in 2005. The updated version in 2014 is still on the website, and we'll talk about that more in a minute. That plan, and 13 out of 13 provinces and territories had a plan very similar to it, were not used in the pandemic. Neither was the federal plan. So let's just talk about emergency management and what we do in emergencies. First of all, we always use confidence, not fear. And you saw every government in Canada use fear as the motivator, not confidence. And by confidence, I mean the Premier should have been saying, we have plans, we're ready to respond, we will keep you constantly informed. Here's what our plan is, and issue the plan to the public. But let's remember, pandemics happen continuously. This is the 5th in my lifetime. I hope to see at least one more, not because I like pandemics, but because I don't want to die. Emergency management is the foundation of the response for all emergencies, not just pandemics. And the key in emergency management is we're a democracy. So elected officials should always be in charge, not medical officers of health, not the police in a terrorist attack, always the elected officials. We have existing plans in every province and territory for all hazards across the entire spectrum, from natural hazards right through to human-induced hazards. And those existing plans are there, built with all the best minds in the province at the time, so you can bring them out, dust them off, and make them specific to the emergency you're facing at the time. They're built with the full team across the private sector and the public sector. They are solid plans, and they should be used as the first step when you see a hazard emerging. It is an all hazards approach, but the hazard assessment for the specific hazard starts right away, well before it's hit. In a time like a pandemic, you see what's coming. And we'll talk about that very quickly in a moment. But every decision you make is based on a cost-benefit analysis. So if I do this, what will be the outcome? Does it do more harm than good, or does it do more good than harm? What we saw during this pandemic was the cost-benefit analysis process was completely omitted. It's also based on mutual aid and surge capacity with municipal order of government. Talking about Alberta, there's 314 municipalities, town and above, that all had pandemic plans, annexes in their plans that were all ignored so that the municipalities could work together. They were completely ignored. There should be in every emergency a written plan issued to the public so the public knows their role and can see the plan evolve and give evidence and feedback as it goes along. So public pandemics are public emergencies, not public health emergencies. In our pre-written plan, there was 4 goals, and I'll let you read that on your own time. But the key concept is you minimize the impact of the influenza or the pandemic on the public. What we did was exactly the opposite. We decided that we would do the maximum and damaged our society by completely ignoring all 4 of those goals. That's in the Alberta Pandemic Influenza Plan that's still on the government's website. We knew in February 2020 that this particular virus was extremely deadly only to people over the age of 65 with severe multiple comorbidities. This is the data from February. I have many slides that go month by month. This never changed. We should have never done anything to the people under 65, allowed them to use natural herd immunity, and you've heard that in the Great Barrington Declaration. This is the latest data in 2023. You can see Canada was no exception. For people under the age of 65 who did not have 3 or more comorbidities, COVID simply wasn't deadly. And for the group that was over 65 with 3 or more comorbidities, survival rate was 97.7%. That's the survival rate. One of the things we did was we used non-pharmaceutical measures, and I constantly hammer on this because that study that you see on the left was issued in September 2019. There are 15 of them that we now call lockdowns, but if you look at the list of what NPIs are, we did all the ones in red that you should never do. They have very little effect on the spread of a virus, of any virus, and yet they have massive collateral damage, which includes massive impacts on personal health, societal health, people with other diseases because they're too terrified to go see their doctor. So people who have cancer appointments, with diabetes, with all the other severe conditions. Probably the worst thing we did was we destroyed our children's education and socialization for 2 years, which they will never recover from unless we take specific action. We have decimated our economy and our democracy. We just completely crushed rights and freedoms. This was a cartoon given to me in the spring of 2021 by a student in a high school. And what you see is what we did is we protected the medical system at the expense of everything else. So if I can stop sharing, that's my brief introduction. I hope that sets the scene. I tried to contact 13 out of 13 premiers starting in April of 2020 to stop them doing this deadly response, to actually administer the plans that they had. I worked with every one of their offices for 12 months. I gave up in March of 2021, and I wrote a paper which is published, which I hope is going to be used one day to hold them legally accountable. It's called Canada's Deadly Response to COVID-19, and you can find it published on the Frontier Centre for Public Policy. It has been used in court and was the basis of the testimony that overturned all the public health orders in Alberta in the Ingram case.
So I'm going to ask Gary, before I pose the first of 10 questions, Gary, any response? I mean, is David off his rocker, or have you, is what he has just shared with us the perspective that we should all be aware of?
Oh, absolutely. Can you hear me? I just changed onto my headphones. I just want to make sure. Good. Yeah, I have utmost respect for David. We've sat and talked many times about this. I've seen the full presentation he has here and others he has, and read his material, and it's amazing. We do refer to it in the report. This is what should have been done. We had it, and I guess the question always is why did we not use what we had, and why did we go to what we did? And not only did we, but all of the provinces federally and most nations on the face of the earth did the same thing. Why did we do that? And so, but I agree that what he has here was how it should have been done, how it's been done in the past, and it got thrown away. And the question is, who decided that and why?
Well, therein lies, I think, the essence of what this is all about. You noted, David, that this was taken on, that one death is too many. And the focus was so individualized, so personalized, so health oriented that we forgot the implications for society at large. There's huge tension, and that tension exists today as the relationship between those that are supposedly caring for society, those that are supposedly caring for the public, and those that are caring for individuals. Those layers seem to be unable to communicate comfortably with one another and to allow the role of society to emerge. How do we avoid this in the future? Ari, you want to jump in here and before I go to question number one?
Well, I can say that the response should have followed the emergency management process. And if I can, I'll just say a bit more about that. And I have to say that David Redmond is the one who taught me about this because doctors do not know this. And that's why doctors should not have been placed in charge of the pandemic response. But some comments. So, when the emergency management process involves establishing a governance task force, and that's to provide leadership for all policy programs and actions. And the task force is led by the most senior government official. Here, that would be the premier. And all decisions implemented are approved by elected government. And so that is one part of the YAM process that was, I think, not followed. The other is that the emergency management agency performs that emergency management process, meaning it coordinates the response and ensures evaluation of the risk hazard, the mission analysis, defining courses open and cost benefit analysis of each course open, and expected collateral damage is not de-emphasized, which it was, and plans are made to deal with collateral damage. And importantly, healthcare surge capacity had to be created instead of simply reallocating existing resources by shutting down healthcare for everything other than COVID. And another part of the emergency management process is all those steps occur with diverse expertise to prevent groupthink and foster critical scrutiny. And finally, there has to be a published evidence-based response plan because people have to be shown transparent, demonstrably justified due diligence because their rights are and freedoms are being restricted. And the Oakes test says that that published plan shows that the response is justified by due diligence, and it has to invite feedback because the process is repeated as new information and feedback occur. And feedback, contrary to chosen courses open, has to be considered instead of being labeled so-called information. But that's probably going to be discussed later. So yeah, I agree with what David Redmond said, and I consider it a failing of mine in the first few months of the pandemic to think that medical people knew how to manage something as with such immense impacts on entire society like a pandemic.
Well, you know, in retrospect, at the time, society had not had experience with, quote, an emergency. Certainly nothing of this scale. They didn't know where to turn.
Yeah, I disagree with that because what I would say is, you know, the early information coming from China told us what the priority should be for focus protection. That's number one. Number two is we had pandemic plans already available. The World Health Organization had one, Alberta had one, and we knew what the priorities were and historically what would work and what would not. And finally, we knew the emergency management process, and that was what pandemic plans previously had stated should be followed and coordinated by an emergency management agency with expertise. So this whole thing that people claim that we didn't know, we didn't have experience with this, I think that is false, in my opinion.
Let me clarify, Ari.
Yeah,
By the we, I'm talking about the public. I'm talking about the people, the mom and pop from Rimby, the teachers, the public at large, the millions of individuals that didn't know. They're not part of that we. And the media listened to them. I can remember sitting and doing puzzles at a dining room table and listening to the radio that by the hour was talking about this like a hurricane was emerging. There was no doctors on nobody from emergency management was called on to speak at that time. The media paid no attention whatsoever, to my knowledge, about anything other than the emotions that were emerging within society at large. That pressure must have been enormous.
So if I may,
well,
Yes,
that's
David.
the complete failure of the leadership. The media always attends. Okay, when September 11th happened, let me give you an example. The Premier of Alberta, Ralph Klein, immediately formed the Task Force of Security on September the 12th. I was invited to be part of it. And from that day forward, the Premier was on television every afternoon at 4:30, talking to Albertans, bringing confidence to the situation, not fear, pulling down the rhetoric, pulling down the tension, and explaining exactly what people like me were doing behind the scenes, building this across every industry in Alberta, working with every government department. What we saw happen in this pandemic was a complete failure of 13 premiers and a prime minister who ramped up the rhetoric, went to the full fear mode, and then closed their societies. That is a failure of leadership that must ultimately be held accountable. And I mean the premiers and the medical officers of health. Until we hold them accountable, the public will continue to believe that lockdowns worked and they caused far more damage to this day than they prevented, and that the only way out was a vaccine. I'm an emergency manager. I'll let others talk about vaccines, but what I'll tell you as an emergency manager, in every one of the plans in Canada, vaccines aren't even discussed. Do you know why? Because a vaccine takes 5 to 10 years, if even possible, for a virus that doesn't mutate like COVID mutates. If you can create one, they take 5 to 10 years to be safe and effective and proven to be before you use them. So as an emergency manager, the last thing on my mind was a vaccine. Mine was treatment, and minimizing the overall impact on all of our business, on all of our citizens. And the mission statement should have been to minimize the impact of COVID-19 on Alberta. Instead, it was to minimize the impact on the healthcare system. Huge differences.
David, Alberta wasn't in isolation in terms of its reaction. Were there any countries that were listening, or was the globe caught in a group think?
Parts of the globe were, but parts of the globes can't afford to put all their citizens at home and pay them to do nothing. 50% of the world did none of the above. But the best example, if you want one, with a climate just like ours, is Sweden. The head of the agency in Sweden said he would never order people to wear masks. He would never order them to lock down and close businesses. He would never close schools. He did none of that. And Sweden came out as the best country in all of Europe after 2 years after the pandemic in terms of number of deaths and almost negligible impact on their society.
So there were
If
lessons.
you look at Florida, Florida started full lockdown. After the first 3 months, the governor of Florida asked Dr. Jay Bhattacharya, one of the authors of the Great Barrington Declaration in the fall of 2020, to come and talk to him, realized what they had done was wrong, publicly went on television and announced what they had done was wrong, and they never locked down again. They never used the non-pharmaceutical interventions. And Florida, with its extremely aged population, came out better than almost all of the states in the United States. So real leaders followed the plans we had written, and they came out far better.
Okay, so far this is crystal clear. Gary, your report echoed, I think, much of what David is referring to, and yet seems to have bumped into controversy coming specifically from doctors. Why are we having, I don't know whether you can answer the question why, but we are having difficulty getting David's perspective to be adopted. It sounds like it's not only scientifically based, it's based on what societies benefited from the lessons learned from Sweden. Any sense of what we might do differently in terms of getting David's perspective to be adopted by the medical profession itself?
Yeah, I've talked to Anders Tegnell, Dr. Tegnell, who is the chief medical officer of health for Sweden through this, and we talked about it. And he literally just kind of laughed when we talked about what Canada did. And not only that, he said, almost every country in the world phoned him or wrote him saying, so what are you guys doing and how you doing it? He said, one country that nobody ever contacted me from? Canada. Why is that? And I couldn't answer him. And so the moral of the story is whatever we did, we should do different next time. Like David has said over and over, we had a plan. It was full scope. It just didn't look at health, and it definitely wasn't run by doctors, like Dr. Joff said, because we have too narrow of a vision. We don't see the whole story. So we threw it out. The question is, and I said this before, is every province did, and almost every state did, and not almost every country, but most developed countries did. And my question is still, why? Who told us to? Who told us that was the best approach? Because they all did it. And then how did they make them do it? So our premier threw out David's plan, or the one he largely constructed, and then went with this WHO-derived EOC system that all the provinces did, and Canada did, and most places did. Why? And that's the real question. What forced people? And when we talk about the media, the government has really no control, the provincial government, over what the media says. And there's this interesting committee called the Pan-Canadian Pandemic Response Committee that's federal, set up in 2017. Inside of that is a Council of Chief Medical Officers of Health, of which Bonnie Henry's been the chair since inception. Inside of there's this little committee called the Messaging. And they're the ones that sent out the messages to the media to get everybody wound up. That wasn't provincial, that's federal. CRTC, which runs all the airwaves, is federal. Why? How come? What could we have done to stop this? How could we cut off this stuff? I don't know how, and I'm not sure if the government at the time knew how either, but that's what needed to happen. I agree. They ramped the fear up until people just complied out of absolute fear. And it was based on nonsense, it seems. But these are the things that happened. And what we had definitely was superior to what we did. And like David said, what Sweden did worked better than we did. And they didn't do any of these things, or did Florida. South Dakota never did. They never ever locked down. Texas and Florida followed soon after. And you're right, Dr. Bhattacharya and Pierre Corey and some of these doctors were a big part of it. Dr. McCullough was a big part of Texas's, decision not to lock down again. And I literally drove there within a few days of him testifying before the Senate. I wanted to go see, because I don't believe anything I see on TV. And so I physically went down there and drove all through Texas, and the place was wide open. We flew on airplanes. We were in the malls. We were eating in restaurants. We were in everything under the sun. And I was watching their dashboard real time, watching the hospitalizations drop. Dr. McCullough said they'll drop 85% in 4 weeks. They dropped by 89% in 4 weeks. And trust me, I was there. They didn't lock it down. So why weren't we doing that? I actually came home and literally talked to some cabinet members that were on the EMCC and said, I will pay out of my pocket, and we will fly down there and we will see what they're doing. And I was told you can't do that. So why? And that's still my question. Why? Why did we do this? We have lots of good ideas why, but it was done everywhere. Who get everybody to do this? This is really interesting. And we know some of it, but not all of it. But I agree with David that what we did was wrong. What we had would have worked excellent, way less impact than what we did by light years. And it was just unbelievable how we got pushed around. And we know some of how it happened. And I won't get into that here, but it was very complex for sure. But
Barbara Tuchman in her book, March of Folly, Janice in his review, there have been many books written about groupthink, of mass panic, driven by fear, and nobody listening. And yet postmortems indicated there were many people that knew failure was, that they were doing the wrong thing. And yet this social phenomenon, this lemmings action, is not that unusual. It appears that it occurs numerous times in history and is very difficult to confront. So when
Well,
we talk
it's
about
very,
yeah, go ahead. So when we talk about lessons learned, I'm looking for some degree of confidence that the lesson that we learn will in fact have a bearing on a future emergency, David.
so the key is communication, but when all of your media outlets and all of your medical journals are controlled, and in the United States, they now have proven, and we know what happened in Canada, but we can't prove it as easily. There's been Congress and Senate hearings where it's very clear that Dr. Collins, who ran NIH and had billions of dollars of funding, would only fund projects that supported lockdowns. He censored any doctor who spoke out, and in many cases had them removed from their positions. So there was complete and total censorship in the United States, controlled at the highest level out of the offices of Fauci and Collins. We know this, it's been proven in Congress and in Senate hearings, and we also know through Elon Musk's buying of Twitter that it happened in all of the social media, that government ordered them to remove anything that went against the narrative. The same thing happened in Canada. You tell me CBC, Global News, and CTV were not controlled by the federal government when our Prime Minister was marching out every morning of Rideau Cottage handing out billions of dollars to do exactly the wrong thing, locking people in their homes and terrifying them. And we now put $300 billion onto our national debt in 1 year for lockdowns only. The media was controlled. So why did we have groupthink? Because it was impossible, even through social media, for anyone to hear anything other than what the medical officers of health wanted us to hear.
So Albert Janus, in his review post-Kennedy, with Kennedy's, pointed out a number of things that can be done in order to avoid groupthink. And one of them is every advisor was mandated to present both sides of the coin. They brought in third parties that were not part of the cabinet. They did a great deal to make sure they had a full hearing, not a biased hearing. And that's what I'm trying to get at, David, is I understand the problem. I'm not sure that we put the structures or the processes in place so that we don't get caught up in a bias again.
They are there. It's called the emergency management system. And if you follow it, if you actually, every province and territory in Canada has an EMO. You as Canadians pay their salaries and pay their wages. You should be incensed that they weren't ordered to do their job, because their job demands there's a step-by-step process. And when you get to every single decision, what you're talking about balancing, there has to be a complete cost-benefit analysis done for each step in the plan. And so when you are brought forward, we're going to close schools, there has to be somebody who says, if you do that, here are the studies that say that for every year lost in education, a child's life is shortened by 3 to 5 years, and that their economic income for the rest of their life will be diminished by 15% per year. So are we going to close schools knowing that's what we're about to do to an entire generation of children? That cost benefit analysis was never done. On March 17th, when suddenly it was announced that they were going to close schools indefinitely in Alberta, no one could have possibly have done that cost benefit analysis. And they did it knowing, or they should have known, that's the definition of due diligence in criminal trials, knew or should have known. Those studies were well known, and they were documented in that document I showed you on non-pharmaceutical interventions, because closure of education services is one of them. They knew and did it anyhow, because they didn't follow the process where experts in every field are brought into the task force, so that when a doctor says, I want to close schools, there's 10 people saying, no, you don't, and here's why. But they were in their little groupthink world with no other inputs allowed. And in the emergency management process, when I did counterterrorism, the very first day on September 12th, I said to everyone, we will never deny a charter right or freedom in this country. I've been in countries where that happened in my Army career. If you do that, other than for the minimum time to interrupt and neutralize a terrorist, minimum time, minimum area, you have just let the terrorists win. So what did we do in a pandemic? We let the terrorists win. They destroyed our society without even launching a single attack.
What's particularly interesting here is one of the resistance to listening to authority was that we were going to lose our personal freedoms. And yet that's exactly what happened.
Correct.
Because we didn't listen to a source of authority that may well have ensured that we didn't wear masks and we didn't do lockdown and we didn't do all of these extremes. We did exactly the opposite of what people were asking for, which was protect our freedoms. We lost them.
So let me be clear. Emergency management is never in charge. Emergency management is the government's coordinating agency that works for the premier and the cabinet. The elected officials run the response. But what emergency management does is it brings all those voices into the room in a coordinated process. The elected officials are ultimately the people that run our country. We're a democracy. And so we need to ensure that the elected officials know everything that they need to know as they make decisions, and they're placed when they're given a decision, it's a series of options and they're weighted with all the advantages and disadvantages for each choice. Closing schools, closing small business, closing large scale business. One of the things that was never done, to the best of my knowledge, in any province was a review of the critical infrastructure with the industry in the province. And by critical infrastructure, I mean water into your house, electricity into your house, and your own shelter. So energy, water, and food supply. None of those industries were ever in that cabinet room, never in the coordinating sessions with the doctors saying, if you do that, did you think about when you close that down, whether or not the water treatment in every one of our municipalities is impacted by that decision? Those discussions never happened.
But the dilemma we have now, acknowledging the points that you've just made, is we now have distrust. And so, Gary, your report is an effort by a premier to go about having a postmortem. David, your viewpoints being listened to are an attempt to restore trust so that next time we will, in fact, adhere to the emergency management plan. But if that trust cannot be reestablished, then one of the fundamental pillars of emerging management isn't there. The public will not trust. So Gary, David, Ori, until we restore trust, and maybe that is holding trials, maybe that is having commissions and more of these reports. But when a report gets released and the medical profession says this is nonsense, all we're doing is just leaving us in this swamp.
Yeah, if I can
Yeah, go ahead.
comment a bit about what's been said before about this. Yeah, it's clear that groupthink took hold, and even more than that, what's called mass formation and crowd effects, because the strongest predictor of what any country did in response was what their neighboring country did. And that there's a publication about that nothing else, including how many older in the population they have, how many deaths they were having, what their hospital capacity was, nothing predicted it except what their neighboring country was doing. So groupthink took effect, and then mass formation in the public took effect, because it's a circular argument to say that the public wanted this, because they were told that this was what had to be done or they would die, and they would kill their grandmothers. So that was the problem there. But if I can, for a minute, shift the focus a bit and comment a bit about the best evidence that we have.
Yes.
Because in my view, the only way to convince doctors and the rest of the public is what David was saying is accurate communication of the facts and the best evidence we have. So if I can, I just want to go through a bit of evidence because the paper we wrote was about misinformation, and our opinion is that misinformation is just a label that's being applied so that critical scrutiny of what was done doesn't ever have to happen. And so we have to get rid of this term misinformation and censorship and say no. Rational debate is needed, and that's why I'm so happy that you're having this forum. So now to go to a bit of the evidence. Um, Lockdowns, the best meta-analysis of lockdowns shows that they reduce COVID mortality in a population by 3.2%, which means, and in our paper we give this calculation that 0.1% of worldwide deaths were prevented by lockdowns, 0.1%. Now, there are many other causes of deaths in society that we are willing to accept in trade-off for our freedom and well-being. And remember, so lockdowns might have prevented 0.1% of population deaths. Well, motor vehicle collisions caused 2.3% of those deaths. Alcohol, 5.1%, tobacco, 13.7%, and dietary risk factors, 18.8%. So if we're serious that we want to protect the healthcare system, which was the only goal of lockdowns, then a better way to do that is to outlaw all these freedoms that we accept, knowing that they have risk. So people developed a totally miscalibration of risk and undue fear. As an example, the infection fatality rate for people under 70 years old was 0.095%. That means that 99.91% of people under 70 who got infected with the SARS coronavirus 2 survived. And in fact, children who we thought we had to protect by closing schools had an infection fatality rate of 0.0003%. That means 99.99997% of children who got infected survived. That's better than children's survival rate from influenza in each winter. So that's one, the lockdowns. The school closures, we now know that there's massive learning loss, that there are what's called third bucket students that people don't talk about. But those are students who left the education system and never came back. They went to employment or they just never came back. And as David said, each year of education lost has an effect on their lifelong earnings and their lifespan. And continuous masking in the community and schools we knew before was not effective, and now we have even more studies to show that they were not effective. But they weren't just not effective, they were harmful because they made kids afraid of their friends as a disease vector, and they impeded education and development, especially for people that are learning a language or hard of hearing. And another, vaccine mandates, we're told that those were required to protect the healthcare system. But in fact, in Canada and the United States, the vaccine mandates increased the population vaccinated by less than 1%. Less than 1%. They were a miserable failure, but all they did is make people report on their neighbors and have all their rights and freedoms taken away and coerce them to take vaccines without informed consent. Even the vaccination campaigns did not target the right groups. They didn't target older adults who were high risk. they mandated it at universities. And in fact, that's now been shown to cause far higher number of hospitalizations and severe adverse effects, including myocarditis, than the virus ever could have done to those children. And even the vaccine efficacy was greatly exaggerated. And I can get into that if you want to know more, but it was greatly exaggerated. And in fact, natural immunity was ignored. And healthcare didn't even, in my view, increase surge capacity. All they did was reallocate existing capacity so that everything other than COVID cannot be looked after. So to me, that's what caused immense collateral damage. And I'll just go through some. Mental health, learning loss, missed healthcare screening and care, increased inequality, increased poverty, food insecurity, gender violence, missed childhood vaccination, undetected and untreated tuberculosis and HIV, social isolation and loneliness. Something I did not know before I looked into this is that the strongest risk factors for shortened lifespan and early mortality are social isolation and loneliness, opioid and drug and alcohol abuse, and sedentary lifestyle. And so those are all the things induced by lockdowns, and they will increase the mortality in the population far more than COVID ever could have. And finally, one other thing I didn't know is that the effects on the economy from the shutdown and the immense government spending, people claimed was lives versus the economy. And that was a complete false dichotomy and totally misleading for several reasons. One is that the economy is lives because the government spending on social determinants of health determines population well-being and population lifespan. And when the government can't spend on those things, which it won't be able to for decades to come because of government debt and overspending, and the lockdowns closing businesses with unemployment, that will cause far more deaths because of lack of spending on the social determinants of health.
I have one question for the three of you. You made reference, Ari, to ensuring that public health survives, that the public understands that public health has learned a lesson. And David, you've certainly made reference to the fact that governments hopefully have learned a lesson. What about the doctors themselves? I mean, we've got three layers here. We have the doctors and their interface with people. There's a trust there. We have the public health system looking at the public at large, and then we have the government looking at the society. We have this onion. It was uncoordinated. They were fighting with one another. They left the public confused. How do we make sure in the future that either the doctors acknowledge that they have learned a lesson, that the public health says they've learned a lesson, and the society says they've learned a lesson, and we will work together in future so that all three layers are coordinated? Go ahead, David.
So I have a three-step process that I say near the end of every one of these presentations. There must be a full public inquiry run with a judge which has the powers to lay charges, and we must hear all pieces, and there must be a justification for every public health order given province by province because they were different. So a full public inquiry with powers to lay charges. Here in Alberta, the second step is to completely implement the Dr. Gary Davidson report and the Preston Manning report. All of the recommendations out of those two reports, and it must be done publicly, visibly, with a complete press announcement by the Premier on each recommendation as they're implemented. And the third step, there must be a full recovery plan. a recovery plan for the mental health, societal health, other severe illness and diseases, the loss of education, the economic devastation, and the destruction of our democracy, a full recovery report, step by step, that says how we're going to build back and recover the losses that we've occurred. And that again has to be public. So with those 3 steps, what you do is several things. The inquiry holds people accountable and criminal charges are laid, and people learn from other people going to jail. Number 2, the recommendations implemented will stop the overreach in the future of those 2 reports, at least in the province of Alberta, as an example for others. And the recovery report will show people that the government actually cares and realizes what they did is wrong and is trying to help those people recover their lives.
So this sounds very much like reconciliation.
Well, you can call it any term you want. I call it a recovery plan. That's what it's called in emergency management. And a recovery plan is very detailed, and you follow the same process to make sure your recovery plan doesn't do more harm than good.
So we had a failure of leadership in terms of addressing COVID. Are we going to find a failure in leadership in terms of lessons learned?
So far,
Are you confident that
no.
either our premier can provide a leadership role or our new federal government will apply somebody needs to be the leader that says we've got an accounting here for the public? That should be politically popular.
I would hope that in Alberta we could do it and lead others, but I'm doubtful now. I was much more hopeful a year ago. I'm very doubtful now, and I don't see it happening in any other jurisdiction in Canada. So my only hope is, and I know people might throw rocks at me, but what's happening south of the border, in particular with Dr. Jay Bhattacharya now taking over NIH and some other people that have been put in places, that knowledge will come across the border. Like so many things, Canadians have to wait for someone else to understand and start these processes with inquiries and recovery plans.
Well, you're speaking to the converted general. I think we are well aware that, get past the rhetoric and get into the substance, and you realize that there are some real issues that need to be addressed. You've talked about accountability, whether it be for our kids, the seniors that died, the families that suffered, the industries that paid a price. There must be some form of accountability other than, yeah, we lived through it, we survived. I hope we'll see the leadership. David, Gary, do you want to echo what David said, or do you want to challenge it in any way? Can we expect to see leadership as a byproduct of your reports and what areas Ari has said and David?
Right. Well, again, I agree with what David and Ari have both said. Yeah, very exactly the correct thing I agree with. So the question is can the government then take the recommendations and implement them? There are some that have already been implemented to some degree. I shouldn't say we, but the government here has adapted or amended the Health Professions Act, and then we can change policy without having to change law after that. And that's already done. There's things that were done with the Bill of Rights so that we can never take away somebody's personal autonomy again. So there are things that are already happening. I've met with the premier a number of times, obviously, seeing this is who I was doing this for, and very recently met with her and going over the recommendations point by point and which ones can we do, how do we have to do. Some are changes of law, some of them changes of policy. Policy changes are relatively easy. Law changes obviously have to go through the legislature. So there are some that have been done, there are some that are in process, and then some we're trying to figure out how to implement them. I'm going to just back up a little bit, and I asked the question earlier, why did everybody do this? Why did all the provinces throw out their existing management plans and take on this one that just seemed to be horrible and had so many profound negative effects that didn't seem to be looked at, but was done very deliberately? And that's still a why question. And who forced them to do it? This doesn't sound like this is what Alberta government wanted to do, but they sure did it, or any other government. The question is why? What was the factor that forced us to do it like this? And I think that's the question that has to be answered first, because we don't know why. We can't stop it from happening again. And I'm going to, the example I give, and it's not completely 100% accurate, but it gives you an idea. In Canada or United States, in most countries in the world, there's a central bank. The central bank owns every dollar bill you have in your wallet. They have a serial number that do not belong to you. They belong to the central bank. You're allowed to use them in a manner that's legal in your country, that's regulated by the central bank. You can then write a check from one chartered bank, which is chartered through the Central Bank of Canada, to another bank, which is also chartered. So you can write a check and it will get cashed at the other bank. That's only because they're chartered through the Bank of Canada. That's how it works. You can't just print your own money and start using it. You'll get yourself in trouble. You also can't use those dollar bills any way you feel like it. You'll also get in trouble for that. And they can take away those dollar bills in your wallet and not give you anything back for them because you don't own them. You're allowed to use them. The FDA is very similar to a central bank. All the drugs have a DIN number. I'm allowed to touch those drugs, have anything to do with them, whether I'm prescribing them like a family doctor or using them like an anesthesiologist or even a surgeon. I'm allowed to do that only because I'm registered with a chartered institution through the FDA. That would be a college. So I belong to the College of Physicians and Surgeons, and the pharmacist belongs to the College of Pharmacists of Alberta. So that allows me to write a prescription that can be then cashed at the pharmacy. That's regulated by the FDA because they own that DIN number. I can't just do whatever I feel like it. I can't have my mom write a prescription and somebody take it to the pharmacy and get it cashed. It won't work. So, was it possible that this control method was used to implement everything we saw? Were we somehow forced to do this? And they say, well, there are states that didn't. You have to understand that the states don't, the state doesn't control healthcare. So they're private, they're hospitals, HMOs, etc. And then there's Medicaid, VA, and all that. That's federal in the states. The state has very little to do with health. They can do whatever they want. They're not regulated. But here, health is all, for the most part, or almost entirely, regulated by the government, paid for by the government. So the government may have been told they had to do this, or there was a problem. It sure appears that way because somehow we were forced to do it. And I'm saying if we don't address that, why we did this, what the why was, there's no way we can deal with the how, because it will be impossible. We'll have to do exactly what we did next time, until we change that. So we're talking about Dr. Bhattacharya becoming the head of NIH and Robert Kennedy Jr. being head of HHS, and more importantly, Dr. Marty Makary is going to be the head of the FDA. That's the central bank for all things medicine in North America. So when they change the head of the central bank, I can tell you the charter institutions will change. And so you're right. What happens down there is going to greatly affect us. The question is how? And that's the question that has to be answered. Why did we do this? Why did everybody do this? And if we don't answer the question why, we can never do anything about the what. And that's the real big question. Anyway, I'll leave it there, but what Ari and David have said are absolutely correct and absolutely how it should have been done. And I really, really respect Dr. Joff, what he says there, because he didn't always say that all through the pandemic. So that I can tell you, very few doctors have the courage to do the research and then say, listen, I might have got it wrong. Dr. Bhattacharya is another one, who said, hey, I might have got something wrong. Let's do this differently. So I just have utmost respect for that and really appreciate what they say.
Yeah, well, Gary, you have brought to the surface an issue that I didn't really expect today, and that is that it may be more than groupthink. There may be some directives that had occurred from a source of authority that had an influence on how we behaved. Groupthink may be an easy out. Maybe there was, in fact, I don't want to call it a conspiracy, but if there was if this was orchestrated by a body of authority and Canada simply complied, that needs to be surfaced as well.
Well, if you go back to the Prime Minister and Rideau Cottage and his daily announcements of billions of dollars, he said very publicly and very clearly to 13 premiers in the provinces and territories, his exact words were, do the right thing or there will be consequences to healthcare funding transfers.
Yeah.
Right.
Yeah. Well, we have an election coming, whether or not this will surface as an issue or whether it will just be forgotten. I'm hoping that sessions like this, reports such as you've released, Gary, all of what you've assembled, David, whether you have an opportunity, your day in court, and Ari confessing to the fact that even doctors may have started out making a mistake, but can reform them. I'm hoping, Gary, that you are having conversations, and David, with doctors, with the Alberta Medical Association. It would seem to me we need leadership right at the bottom, right up to the top. And I'm not quite sure we're seeing that right now.
I'm more naive than Gary and David. So, and what I mean by that is I have a hard time thinking that there was government directive to do all these harmful things. And I think that it was groupthink, but I think it was uh, the biggest group, the hardest group to get to change will be the physicians. And I say that for a few reasons, because the medical officers of health were put in charge, and it's pretty hard to admit you made a mistake that costs so much. So I don't see them ever being able to say, you know what, I should not have been in charge, and the emergency management agency should have been. So my first point is, I think it does take things like Gary's report and Preston Manning's uh, uh, governance review panel, where legislative changes have to be made that explicitly state that the emergency management agency is the coordinating agency, that it follows the emergency management process, and the medical officers of health are subject matter agencies, and they can give advice, but they do not make the decisions. So I think it has to be legislated, because I don't see doctors changing their approach. And the second point is, yeah, I have lost faith in the Alberta Medical Association, in the Canadian Medical Association, in the American Academy of Pediatrics, all these societies that I was a member of, because you know what, all they have been doing in response to both Preston Manning's report and then Gary's group's report is claiming it's misinformation. And when they do that, they don't have to engage with any of the actual data and the evidence, the best evidence available. They just say it's misinformation, and the public falls for that, and the doctors in the associations fall for that. The AMA released a statement, and I was shocked when I read it because I thought it was going to be a long statement. It was two very brief paragraphs where all they did was claim it was misinformation. And then the same actors wrote to the Edmonton Journal and the Globe and Mail saying that it's all misinformation without giving you any of their own evidence. So I think that it's going to be very difficult to get the doctors on board, and that it's going to take a strong government with legislative change. And that's beyond my expertise.
Well, I for one, through the KEI network and what we do, are of the belief that the public needs to step up. We are the ones that ultimately suffered. We are the taxpayers. We were the patients. We were the seniors in the nursing homes locked down. We were the parents who watched our kids and are watching our kids today failing with that, what I call a COVID hangover. It's all well and good to have David up there and have you, Ari, and have officials now with quote knowledge and credentials and initials. But until the public says we were duped and we have pained, in a democracy, we should be taking more action to say accountability is in our interest and our children's future as well. So I'm going to leave it at that. I am looking for hands. There's been a very rich dialogue I see off on the Just a Chat session. So we've got two things going on today. There's a lot of discussion off on the chat, but is there anyone right now that has a burning question or point that they wish to make?
Hey, I've got a next door neighbor who is an emergency room nurse. And if anyone questioned anything to do with COVID, she would tear your parts off your body
Exactly.
with a lot of anger. She wasn't she wasn't the chief medical officer of Alberta. She wasn't emergency response, but they were overwhelmed. And I don't know if it's like a drowning person who's up to here,
Overwhelmed with what? Overwhelmed with what? With misinformation?
overwhelmed with patients and they're flooding their ER room
At what age?
February, March, April of 2020.
At what age? What was
Always, they were overwhelmed and they didn't know what was hitting them.
I walked through the emergency rooms and there were hardly any patients there because it was shut down. If you're talking March 2020, it was shut down for everything except COVID, and no COVID arrived in that first wave. So I think that's a bit inaccurate. But
She'll rip
a
your
lot of the staff was told that they're being overwhelmed in other areas, and they took that on face value. But
We're not going to resolve that miss. There's obviously two facts. One, a nurse that's upset and feels that there was something happening, and someone saying no. Go ahead, Jeff. You go
How
ahead.
do you explain the New York City fatalities where they're freezing bodies and
Can I talk about New York
Go ahead,
City?
Gary.
sure, because
I'll talk about New York City. That didn't happen. So I know people that were on the ground both in Cremona, Italy, and New York City personally. I help finance people that were there. So I personally talked to people that were there. So Cremona, Italy, let's start with that one because that one was first. There was people dying in the hallways of the hospital in Cremona, Italy. Cremona has 3.3 million people, size of number of Saskatchewan. It's a small province in northern Italy. And the doctors were so scared to go to work, they didn't show up. The patients were dying in ICU because there was nobody to monitor the ventilators. We put a field hospital in the parking lot of that hospital. And when the team first showed up, they were wearing Ebola outfits because that's what they were afraid of. When they left, they were wearing nothing because they realized it was no big deal, that people were just afraid. So I know personally, same with New York City, we put a field hospital right across from the Sinai Hospital in the park. They didn't see one COVID patient. The reason the bodies were in the freezer trucks in New York is because nobody would come pick them up. And they were piling up in the Memorial Hospital like they would in any hospital anywhere if they didn't come pick them up. So none of those happened. They put a Navy, well, that's fine. They put a Navy ship in the port in New York City and they didn't take one COVID patient. Why not? I know personally doctors that were in New York, ICU ER docs, that opened, they literally leased warehouses and set up beds, didn't take a patient.
Jeez.
What's going on there? So things happened in New York. They sent sick people back to old folks' homes and they wiped out old folks' homes. That happened. But this freezer truck's full of dead bodies. I know people are on feet on ground there. It didn't happen. The way it's being said, there was definitely things that happened, but that's not what happened.
so
And I know
an evidentiary record can deal with those things.
Okay, Jeff, your comment?
Yeah, so I was watching COVID from 2019 when Johns Hopkins was tracking it and all of the cases and all of the deaths from China. And I thought it was very interesting that the way that China locked down their society, they were taking the pandemic very seriously. But at the same time, they were insisting that the borders stay open. And I was just wondering if anybody wanted to comment on those two, the dichotomy there, and if there's something more nefarious at work.
The China lockdown only happened in Wuhan. Okay, it was a staged show because the rest of China never did that until much later. And it was done because China was deathly afraid they were going to be blamed for this pandemic. And everyone knows all of the discussion about the Wuhan lab and Canada's class 4 lab in Winnipeg. But the lockdown in Wuhan was a very big show for the world to show they were trying to stop it. One of the things, if you look at the non-pharmaceutical interventions, one of them is border closures. And one of the things that was studied over and over and over again in every one of the outbreaks, remember, pandemics happen all the time. This isn't our first. They say border closures have almost no effect on transmission. You know why? because food and merchandise travels constantly in this world. And you can say you're closing the border. When we said we closed the border with the United States, 10,000 trucks a day cross back and forth across the Canada-US border with our border fully closed. You can't, in a global economy, close borders. And so the virus is going to spread, particularly one that's infectious. So the whole thing is stage management at times. Read that document that was on the slide. You can go through each of the NPIs, and the reason why those ones are in red, all the ones at the bottom, is because they don't work, but they have massive impacts.
Thank you, David. Benita, point or comment, be short if you would.
I just want to ask our presenters about getting through to the people who aren't yet in our mindset. They're holding on to old beliefs because of that mass formation. Can you give one suggestion? How do we get through? How do we break through? How do we bring them a step in our direction? And that includes mainstream media.
Let me circle back. There's 3 steps. Step number 1, a public inquiry with the media present. Step 2, implement the Joffe, the Davidson and Preston Manning report, and don't do it in silence. That's what the Premier's done. She's done some of those things in silence. They've got each step, each recommendation has to be announced, what you're going to do and why to the public at large, and then a full recovery plan admitting what's wrong. That breaks the mass formation. That breaks the entire group thing. You have to go step by step. And the whole point of it is to educate the public. It's not to educate anyone else. It's to educate the public. 3 steps.
David, could you put that in a 3-page document?
I think I can put it in one paragraph.
Thank you. I'm serious though. If you could send me that, I would like to have that accompany the webinar. Sarah, I know you're talking about the public may be a little more trusting than we have respected. Go ahead, your point.
First of all, I'm a former CBC reporter, and I worked in Calgary, well, in Alberta, very hard for the last 5 years, trying to fight against this. And the biggest issue is not the public getting involved, because they won't. In the election here, only 10% of the voting public was freedom movement. They assessed that during the election. And so the bigger issue is not getting the public involved, it's making the public aware. And the mainstream media, even when we have done the NCI hearings, they're not going to cover anything. And even when they cover stuff that Smith says, they don't represent accurately what she says. They change what she says. Look what they've done with Gary's report. So the bigger issue is not getting the public involved, because they're not going to. And the people like me who've done that are completely burnt out. And so the bigger issue is, how do we control the media? So Gary will tell you that I have suggested that the government sue the media and start suing people, especially for attacking Gary's report by saying that it was misinformation. Those people saying that, there needs to be repercussions. And that's definitely not going to happen at the corrupt federal level, but it could happen at the provincial level. So what I'm asking you, Gary, so I have sent this in also, is two questions. Is there any chance they can start suing people, like for discrediting your report?
Yeah, so can we hold the media accountable? It's difficult because their license is held federally through CRTC. So you have to go federally and deal with it that way. That's the issue. It's hard to know whether you can take away somebody's business license to operate in Alberta if they, put falsehoods out. One of the recommendations in the report is that when a media outlet of any kind says something, they have to quote the research behind it. They just can't say things like that's misinformation. It would force them to say, okay, it's misinformation based on this study, which is fair. And we can have countering studies, but you can't just call something misinformation and call it a day. And so we were just talking about that the other day, and we'll see how that works. It's difficult to do when their license is held federally.
Go ahead, Bill. I'm going to give you the last question, and then I'll ask the panelists if there's any last words that they'd like to share. Go ahead, Bill.
Nice to see him, Colonel Redmond. So I don't think I think it's a uphill challenge to try to get any reconciliation of what happened. What I've seen is it's more waters under the bridge. Yeah, we blew it. Let's move on. And so I am very fearful that we will repeat this again because they're not going to learn the lesson. The question of why, and I'll just make an open-ended assertion here, is since the virus was man-made, and I think that scared everyone in the world because unlike a natural virus, this one had no real background on its efficacy and its infection rate and its death rate, which caused everybody to panic and throw the book out the window, and they started grasping at straws. That's just my assertion, but that's kind of how I read it. Yeah, I really don't think governments or the general population are interested in lessons learned. Again, we can see the news, a lot of reports says, yeah, we blew it. Oh, well, too bad. We tried our best, move on. And again, I'm just fearful we're going to just repeat this. Very, very, very excellent seminar. Thank you, Perry.
Well, I'm hoping that you're wrong, Bill, and I'm hoping that David is right. I'm hoping that there will be some form of accountability. In what form and where the leadership will emerge, we're waiting to see. The media clearly is not taking the lead. There'll be a documentary someday. Our kids and grandkids will probably hear about it, about what it was like to live through it, and the fact that they're living through it and going to carry. Some of them will carry it the rest of their lives, but the education system is pushing them on, and others are just moving forward. So, David, thank you very much. Any closing comments, David or Ori or Gary, that you wish to share?
Until the public demands change, there won't be change.
That's my
Until the
point.
public realizes that what was done was wrong, they won't demand change. And so I'm terrified for our democracy in many, many ways and watching what's going on. So I don't just talk about COVID. I've done a whole bunch of stuff on the 6 national interests of our country. We're, as the ancient Chinese curse, may you live in interesting times.
Hey, Ari?
Yeah, I have two points just quickly to make. We didn't talk about focus protection, but that was the obvious appropriate response that was not used by any jurisdiction. And that was one of the biggest failings. The other is Bill Jones said people are going to think, well, we got through this and they're not interested. People did their best. But I think that's false. I think the leaders who say we didn't know and we did our best, that's not true. And for 3 reasons. Because one, the job of those leaders entailed knowing as much as possible, including weighing predictable harms and benefits and examining previous pandemic plans. And second, it doesn't excuse denigrating those with some expertise who voice concerns due to the vastly unfavorable cost-benefit analysis. And third, the leaders ignored knowledge as it accrued, such as the efficacy of natural immunity, inability of vaccines to stop transmission, inefficacy of community masking, and inefficacy and harms of school closures. So I hope that leaders are taken to task. I'm not sure they will be. And I think at a minimum, the way to get the public to realize this is for them to various medical officers of health and government leaders to issue an apology. And we didn't talk about that, but an apology at a minimum would show the public that, you know what, they made a mistake and they're big enough to admit it and apologize for it and say, next time we'll do better with the emergency management process.
Well, that's my point, Ari, about reconciliation. And I know it's a word that we've used in other instances. Maybe in this instance, it will be meaningful. Gary?
Well, it's an honor to be with Ari and David. It's I feel like I'm among giants. I really appreciate the questions. I appreciate the opportunity to share this, and obviously, I agree with David. I hope they take the recommendations and apply them. I agree that that needs to be done publicly and openly. One of the recommendations is to have an open public inquiry, and so of course I agree with that as well, and a number of others. I'm working still with the government to work on some of these recommendations and make them happen. So that's what I continue to do. As far as accountability, I believe in it. That's just not the scope of what I was asked to do. So I'll leave that to people that are wiser in that area for sure. But I agree that if we hide it and cover it and move on like it never happened, then the people will not trust us again. So I think it's super important. So I appreciate it. And yeah, thank you for the opportunity.
Well, thank you each, Ari, David, Gary. You can, I think we would like to help if in fact the occasion occurs and the communication is of value in terms of helping the public better understand. I mean, that's what this session is really all about. You've done a magnificent job, and I thank you all.